Okay, so just a little bit to finish off our discussion. All right, so your adaptive immune system is responsible for immunity. And that word just means you can be exposed to an infectious agent, but you won't get sick. And remember, sickness, you have signs and symptoms. Okay, there's two types of immunity. Okay, there's lots of different types of immunity, but generally, you can be born with it. There are differences amongst us that can give you immunity to something naturally. They do know that there are some people that are genetically resistant to HIV, so the virus that causes AIDS. The first step in viral infection is attachment, and some people have a altered receptor site, and so it's just genetic, and so therefore the virus cannot attach. And so if it can't attach, it can't infect. And so they realized this when they were, of course, when AIDS epidemic broke out, pandemic, then they realized some people were having sex with people that were HIV positive, and they just never got it. And they're like, okay, what's different about you? And so they looked at them genetically and figured out that they have a mutation, like I said, in this CCR5. See, this is a CD4. Which cells are CD4? HIV infects what kind of cells? Yep, the talking cells, so T helpers. CD4 T helpers. Did you have a question?
What's the difference between an epidemic and a pandemic?
Oh, epidemic is when it is not global. So pandemic is when you have large outbreaks across the globe.
Oh, like pan is like everything.
Yes, like pansexual, everything, pandemic, right. The other type of immunity we get is called acquired. Okay, and you can acquire immunity through different means, and they give them nice little names. And this is going to possibly be on HESI tests. I know it's on NCLEX tests and any other tests. They just really want you to understand how people gain immunity. And it's a combination of words. And if you just kind of slow down and understand it, you really don't have to memorize too hard. Okay, so if something is a natural process, then that would be natural immunity. Okay, so it doesn't require a health care worker. The opposite of that is artificial. Okay, so either it was a natural process, no healthcare worker, or somewhere along the way there was a healthcare worker, scientist, someone was involved. A person can have active immunity or passive immunity. So active immunity, it means that person's lymphocytes responded to the antigen, made antibodies and memory cells, and now they have immunity. Okay, so that's active immunity, and that immunity lasts because they made memory cells. Passive immunity, so passive means, you just let stuff happen. Passive immunity is when someone is given antibodies that were created by someone else. It's borrowed immunity, if you will. And this does not last. Okay, so as soon as those antibodies are filtered out by the liver and urinated out in the kidneys, as soon as those are gone, that's it. Someone's not immune. Okay, so let's look at some examples. All right, you got sick, you got better, you are now immune. Okay, so is that natural or artificial? Natural. Right, okay. And so there we go. And then the second half, is that active or passive? Active, right? You got sick, your body saw it, you mounted immune response. So right, so getting sick to something is a way you get naturally acquired active immunity. Okay? You got your meningitis shot. What type of immunity? Is that a natural or artificial event? Artificial. Yep, you had to go get your shot. Okay, is that active or passive immunity? Will that immunity last? You may have to get a booster. That is true. Were you given antibodies? Yeah. So when you get a vaccine, what's in a vaccine is a piece, some epitopes, antigenic determinants. It can be a weakened virus, a weakened bacterium, so your immune system gets to see it without you getting sick. And then you mount an immune response. And the idea of vaccination, yes, sometimes you need more than one, and sometimes you need boosters and things, but is to give you immunity to a disease that lasts. We'll go through a passive one, and then you'll see the difference. And like I said, through vaccination, we get that initial exposure, right? And so you generate an immune response. Lauren had asked, like, why do you feel bad when you get a vaccine? And that's because your immune system, you get some inflammation. You are mounting an immune response. It is to something that won't make you sick, but you still may have like a low-grade fever. You're going to have aching at the injection site, just some overall malaise and kind of crappy feeling because you're mounting an immune response to something. The second time you are exposed to it, like I said, you have those memory cells, and so you're going to get a stronger, faster immune response, and you'll be immune to that disease. So that's why we use vaccination. All right. Yes?
Why when if you're sick, it's recommended not to go for the shot?
Because your immune system is already challenged.
Okay.
Yes, so you don't really want to get vaccinations when you're already fighting something. You don't want to, all your resources should go to that real infection, not priming you for protection. Yeah, absolutely. Good question. All right, a mother breastfeeds her child. IgA, so immunoglobulin A, secretory IgA, antibodies are transferred, offering disease resistant to the infant. So we're talking about the infant's immunity. Is that natural or artificial?
Natural.
I know, isn't that sweet? Okay, as far as the baby's concerned, is that active or passive immunity?
Passive.
Right, the baby's getting antibodies from the mother, and those antibodies are not going to last forever. Right, so when the mother stops breastfeeding, those IgA antibodies are going to go away, and then the baby is going to have to make their own. All right, a baby, I was on a baby theme, is being treated for botulism, so you should not feed infants under the age of 1 natural unfiltered honey because they can get botulism, which is food poisoning, and it's a neurotoxin. It's a very powerful neurotoxin that can paralyze the diaphragm and cause respiratory distress and death in the baby. So if a baby comes in, you get a floppy baby, and then they ask, Mom, what have you been feeding your baby? And they're like, all natural, and they're trying to do the right thing because sugar's Satan now. So, okay, I gave my baby honey, and it's all natural. And so they need to give them a IV with antibodies to the toxin. So we'll cover the toxin, neutralize it, and target it for destruction. And then they'll give respiratory support. So, all right, so the baby, is that natural or artificial? Oh yeah, they're going to be in the hospital for a while. As far as the baby goes, is that active or passive?
Passive.
Passive, yeah. So they're being given antibodies. So whenever it's a gift or being given or borrowed antibodies, however you want to think of that. And I could have said someone was bit by a brown recluse spider, went to the hospital, and they gave them anti-venom. Same thing, artificial passive immunity. And we do this when it's a toxin or a venom that is already acting in the body and it's doing damage. And so we want to neutralize it and target that venom or toxin for destruction. Okay, good job. All right, so the immune system is kind of like the Goldilocks and the Three Bears, right? If your immune system functions properly, you're free of disease, right? If there's an inadequate immune response, which is called an immunodeficiency, and we're not going to go into it too much, but you can say if someone's without an immune system, they're going to get sick, right? So they're going to get sick when other people wouldn't. Take me for micro, we'll talk about opportunistic infections, okay? And so they could be born with an immunodeficiency. Like I said, you got what you got genetically and how well it works. It could be through an HIV infection. A lot of your patients, particularly those of you going into hospitals or nursing, we have a lot of autoimmune disease, so immune suppression, a lot of cancer patients, which is going to suppress their immune system, so radiation therapy. So because of another illness, people can be immunocompromised, and they're going to get sick more frequently. You could also, where we're headed, is have an excessive response to something, which is a hypersensitivity. And they give them lovely little Roman numerals. Okay, and I gave you a mnemonic to remember. And we're going to talk about type 1, because those are like acute allergies. So I give you pneumonic acid, okay? A lot of you have allergies. I'm going to explain that allergic reaction to you, because that's the most common, so we'll go into that. Type 2 reactions are cellular, so from transfusion reactions. So giving someone the wrong blood, you get a whole lot of cell lysis and complement. If hemolytic disease is a newborn, cells die. Okay, so think C for cytotoxic. Type 3 are called immune complex disorders, and that is when you have a buildup of antigen and antibody, and that damages structure. So glomerulonephritis, when we talk about urinary, I'll bring it up again, but I'm just saying that's just a type. You've got too many antibodies and antigens going on. There are some autoimmune diseases that fall in this category as well. Type 4, These take a little longer, so they're called delayed, so D for delayed. And if you ever had poison ivy, contact dermatitis, like if you had a reaction to like jewelry or deodorant is really common, or just something that was on your skin and then you got the rash later, that's just an example of a hypersensitivity, so type 4. And then, like I said, we'll talk about autoimmune diseases is an inappropriate immune response to self. So multiple sclerosis is an autoimmune disease, myasthenia gravis, lupus, rheumatoid arthritis, Graves' disease that we talked about in endocrine. Okay, that's when the immune system is damaging cells. So we want the just right immune response. So those type 1s to type 4s, they classify them based on a couple different things. One is the time course. So type 1, most common, A for acute. They're just quick and then they go away. Okay, so type 1, type 2, type 3 are quick. The last one, type 4, is delayed and takes some time. The next thing they talk about is, okay, what's causing this problem? Is it antibodies that are causing the problem, or is it T cells or cellular? Is it macrophages that are causing the problem? So that's where they came up with this classification. So we're going to talk about type 1 because it's the most common. So A, think allergies, asthma, atopic dermatitis, so like skin rashes. Okay, in this case, we learned about inflammation from the basophils and the mast cells. When the antibodies made against something, usually an allergen, so an allergen is an antigen that causes allergies, what happens is instead of making IgG, when someone has an allergy, when someone has an allergy, instead of making IgG, you get class switching and the plasma cells make IgE, which causes allergies and inflammation. Okay, so too much IgE. And in that case, so the IgE binds to the surface, and whenever you are exposed to that allergen, they degranulate. These can be systemic, so if you have allergies, like, I don't know, we have a bunch of pollen and things like that, you know, you get the usual, then it's going to be respiratory. Some of you may have food allergies, then it's going to be the mast cells in your gastrointestinal tract that have these IgE antibodies or get all excited. So it just depends what type of allergy you or the patient has. But these are like normal kind of allergies. So if someone says they have an allergy, it's type 1. Because the other ones are weird. So how this occurs, it's not the first time you're exposed to an allergen, and different things can be allergens, right? So foods, pollen, animal dander, but soon as the body is primed, they mount an immune response. And like I said, normally it's IgM that's made, then there's IgG that's made, and instead the body makes IgE. The IgE fixes to mast cells, and then the next time, and every time after that, someone is exposed to that allergen, they get the histamine dump and inflammation that causes either like the runny nose, the itchy eyes, gastrointestinal tract, you know, can cause nausea, vomiting, diarrhea, all those fun things. Some people are highly allergic to things, and this is usually when something has entered the bloodstream, but not always. And like I said, it won't ever be the first time. Somebody doesn't have it goes into anaphylactic shock. It won't be the first time. The body has to be primed first. But in this case, instead of just having a localized histamine dump that causes, you know, runny nose or a little upset, you get a systemic histamine dump. So his systemic inflammation. So you get a redness, heat, swelling. So there's a lot of swelling that occurs with anaphylactic shock. And you can get a rash, so you get hives. And then what happens when there is that systematic dump and everything gets leaky at once, fluids leak out into the tissues, blood volume goes down, blood pressure goes down, respiratory bronchioles constrict, and so anaphylaxis is life-threatening. And that's why people that have these allergies, they carry an EpiPen, which is epinephrine, which stimulates the sympathetic nervous system, which is going to keep them from crashing. So it's going to up heart rate, contractility, and dilate those bronchioles so they can breathe. And so anaphylaxis is a life-threatening event. So A, so type 1, all the normal kind of allergies that you think of, okay? Type 2 is going to be usually having to do with cells, so C. So think blood transfusion reactions, okay? Either wrong blood type, hemolytic disease in the newborn. I is for immune complexes, okay, glomerulonephritis. We're going to talk about rheumatoid arthritis is also an example. And then type 4 is delayed. So type 4, like I said, if you've ever had poison ivy, poison oak, it's not antibody driven. All the other three, notice we have our little antibodies in all these pictures. This one is going to be when we get T cells and macrophages involved. And so they're a little slower, so the reaction takes a little time. So you can go out, you can garden, whatever. This actually happened to my husband. He did some yard work, and he used to work globally, by HUD, and he flies across the world to Holland, and he's presenting, and he, like 2 days after, he had poison ivy all over his arms. He's like seeping. I don't know if anyone ever had poison ivy? It's skin damage underneath. Yeah, it's itchy, it's oozy, it takes weeks to get over. But he's like presenting at this conference, and he's like just seeping. And he just said, I got that armrest to myself on the flight home, that's for sure. Because he was just, anyway, delayed. Type 4 contact dermatitis, so D. All right, so our last part. So that's a hypersensitivity to something that really, for normal allergies, it's things that wouldn't do us any harm. Okay, so type 1, like I said, think dust, dander, things like that. Autoimmune disease is a failure of self-tolerance. So now all the things we discussed can be focused toward body tissues, so self-body tissues. It can be cytotoxic T cells, it could be the antibodies. They are incurable at this point because we don't really know the cause of them. So we can't eliminate the cause, but if somebody has an autoimmune disease, they treat the symptoms is the best that we can do, is comfort and treating the symptoms, usually through immune suppression. So things derived from cortisol and cortisone and prednisone and all those fun things. They don't really know what causes it. They do know it tends to run in families. The more women suffer from autoimmune diseases than men. You know that. It could be, sometimes there is an infection and they think perhaps that antibodies that were made that were supposed to target an infectious agent then have cross-reactivity and attach to body surfaces, so you get a reaction to self that way. That occurs in streptococcal infections, so you can get heart damage from that. And then, like I said, the other things, you just learned how the immune system works, and in the thymus we get self-tolerance, in the bone marrow we're supposed to get self-tolerance. So something new must be happening in the body of individuals that get autoimmune disease. So they think it's either like a small chemical, like a small antigen that will attach to something, like a self protein, and become something new and novel. So it creates a new antigen that is directed against self. Or they also believe that some viral infections can alter expression of genes in the body, and so we get a created new self antigen that is seen as foreign. But there's a lot of research because there's a lot of people with autoimmune diseases, and like I said, they are incurable. Symptoms, treatment is designed around symptom management. Okay, so just like some examples. So celiac disease is for the intestines, so antibodies towards that. Type 1 diabetes, we'll talk about that in Fornit, the pancreas is destroyed. We talked about Graves' disease and Hashimoto's, so those are good examples of autoimmune diseases we've discussed. Lupus affects many systems. Myasthenia gravis is towards the receptor of motor neurons, or muscles at the end of motor neurons, and then rheumatoid arthritis is joint capsules, but all of those are autoimmune diseases. And as far as lifespan changes, everything the body's supposed to do, it slowly stops doing as people age, but there's a reason. As people age, the thymus goes through thymic involution, right? So we lose the school to make new T cells. You can still get T cells from lymphatic tissue, but you're not getting new ones from the bone marrow. Memory cells, they do live for decades, but they will die. They do start to die after decades, and so that goes down. Also, just the response. Plasma cells don't make as much antibodies, so the antibody response goes down. Vaccines aren't as effective in the elderly, and so a lot of things place the elderly to be immunocompromised, so there won't be choices for certain vaccines and certain medical treatments. So just have to take that in consideration. We also said you're always going to worry about young children and infants the most when there's infectious disease because their immune system hasn't developed yet. Okay.